Okay. It is 12:03 and be mindful of everyone's time. I'd love for us all to go ahead and get started. Just because I am probably a newer face to some, my name is Gabrielle Whitmore. I am a minimally invasive GYN surgeon here at the University of Colorado Hospital. And I have the honor of presenting our Grand Rounds speaker for today, Dr. Prem Subramanian, who is the Clifford R. and Janice N. Merrill Endowed Chair in Ophthalmology and is a professor of ophthalmology, neurology, and neurosurgery and Vice Chair for Academic Affairs at the Sue Ann Shoes Rogers University of Colorado Eye Center and School of Medicine. He is also an adjunct professor of surgery at the Uniformed Services University of the Health Sciences. He received his medical degree with high honors and PhD in molecular and human genetics at Baylor College of Medicine in Houston, Texas. He is a founding member of the medical staff of the Marcus Institute for Brain Health, which serves to improve the functioning of patients with traumatic brain injury through intensive outpatient rehabilitation. He's also an active orbitocranial surgeon with a specific interest in tumors of the skull base and small incisional approaches. His current research is focused on finding more effective medical treatments for patients at risk for progressive thyroid eye disease, developing better treatments of vision problems in patients with increased intracranial pressure, and using vestibular and visual therapies to overcome visual and balance dysfunction after traumatic brain injuries. He's also the chair of the Council of the American Academy of Ophthalmology and a member of the Board of Trustees, chair of the Board of Directors of the North American Neuro-Ophthalmology Society, and serves on the Board of Directors of the North American Society of Academic Orbital Surgeons. He has published over 260 research articles, book chapters, and web-based educational materials, and is a dedicated educator in several countries around the world. Thank you again for speaking with us today.
Thank you. It's a real honor to speak to this group, and I'll jump right in and see if we can get the slides to share. Shared before, and so there we go. Should work. Good. Let me just collapse that. So yeah, I'm Prem Subramanian. Real pleasure to speak to you all today about a topic that has been pretty central to one of the things I do, which is as the Vice Chair for Academic Affairs in our department, providing guidance and mentorship to our faculty and helping them to find mentors of their own. And so I think it's a really key element, and particularly in this day and age when we talk about resilience and the things that we want to do in order to have resilient and compassionate physicians. I think this applies to scientists as well. You know, the title is physicians, but I think it is applicable across the School of Medicine. I have no relevant financial disclosures regarding this talk. And so just taking a step back for a second, the whole concept of mentoring comes from the Greek myth of Odysseus leaving to fight the Trojan War and leaving his son Telemachus in the care of his friend Mentor. And Mentor really is to guide Telemachus from youth to manhood. And this is the ancient concept of mentoring, that it's really this guidance and development. And I think this concept comes forward in a more modern era where we have the idea that the mentor really, I think the critical function of the mentor is to help the mentee accomplish their dream. What is that dream? I think for most of us, we could quantify that as a desire to succeed, to accomplish, and to leave a legacy. You know, those of us who are in academic medicine, again, whether we're on the research side, on the clinical side, somewhere in both, we're really looking to make an impact on our patients, on the world, and to leave that legacy for the betterment of people to come behind us. And so really, a mentor is an experienced and trusted advisor who has a direct interest in the development and education of a less experienced individual. And that experience, again, can be directly related to a medical topic, to a research topic, or it can be more broad. It can be leadership, it can be team building, it can be negotiating difficult situations. Really, that mentorship also changes over time, as we will talk about as we go through the content of this talk. So what does any of this have to do with resilience and compassion? Well, I think if we look at resilience, right, the topic has received a lot of attention, particularly in the past decade. And I would think even more so post-COVID, where there are new challenges that we face in terms of patient care, in terms of interacting with our colleagues, and really just negotiating our way in a little bit different societal realm where perhaps people are a little more self-centered than they used to be. And we need to be resilient in that regard. And this study, interestingly, looked at ways of encouraging resilience in residents. And a lot of it, as you can see, they made little videos from trusted senior faculty and posted them and had the trainees view them. And the advice from the more seasoned clinicians was quite varied, as you can see over the text on this slide. But it was really modeling behavior, but also I think that resilience, the example being given here is that people were finding value in the work they did, finding value in their own daily activities, and encouraging others to find that value. Well, mentorship, a key element of that is helping people to identify their goals and to then accomplish the things that give them value in their own lives, that allow them to feel valued, to feel strong in what they do, to feel that they are accomplishing those goals that they set out for themselves. And if we look even at the concept of compassion, this was a study published out of the Netherlands recently, where they did interviews with patients, with physicians, and then also some trainees. And they identified four key areas that really were associated with compassion: being there with and for patients, being able to empathize, feeling that you can act, and then making a connection with the patients. Well, again, and then professional fulfillment was an aspect that really was more confined to trainees in terms of their ability to be compassionate. But I think if we again look at this in the concept of how an individual physician or an individual researcher even is able to exhibit compassion, able to have these qualities, these positive qualities, and not exhibit the negative aspects like a lack of empathy, showing stress. You do that by being secure in your own career, by being secure in your own accomplishments, and by feeling as though you are supported in the daily activities that you are doing. So mentorship does not have to be done, I think, in a particular way in order to encourage resilience and compassion in physicians, in researchers, just in society at large. I think it is a natural byproduct, a natural outcome of good mentoring that people then will be able to be resilient and will exhibit compassion, because that becomes a core element of being able to succeed. And so really, as I go through my concept around mentoring and hopefully give you some examples of things to do, models to follow, the resilience, compassion, the encouragement of the people we are mentoring, and then the mentorship that we get ourselves, all of that really feeds into this ecosystem. So what are the benefits of having a mentor? Mentors are perceived, understandably, by mentees as being important in career advancement, career satisfaction. They look to mentors to guide them, to help them follow along the path that the mentor may have followed. But it's not a blind following of that path. It's not that they have to follow in a mentor's shadow. In fact, that's probably not a good way to think of mentorship, because it's more that mentors influence personal development, career guidance, career choice, and then research productivity in papers and grants. And it's really important that we keep in mind that a mentee may come to a mentor to learn certain skills, to develop certain areas of their career, not because they want to follow in that mentor's footsteps directly, but there are certain elements of what that mentor does. And I think that's a lesson that I learned early in my mentorship journey, was that there were people who came to me for mentorship, and I had this idea of what I thought their career path should be. I had an idea of what I thought their goals might be. And then they turned around and had not goals that I disagreed with, but goals that were just different from what I envisioned. And it's very important that as a mentor, you fall solidly in behind that mentee. Sure, if the goal is unrealistic or the goal is you think they're somehow not suited for that, then you may have a discussion around that. But just fundamentally because you think that maybe they should be doing something else is not a good reason to try to put them on a different pathway. And so when I talk about mentorship, I like to talk about my own mentors and what they have provided me over the years. And these are three individuals. They all happen to be neuro-ophthalmologists, but they have helped me in different aspects of my career. I've met them through neuro-ophthalmology, but on the left there is Neil Miller, who is now a retired professor of ophthalmology at Johns Hopkins University. He was my fellowship mentor, and then he became my faculty mentor when I joined the faculty there some years later. And Neil is someone who was very helpful to me in terms of identifying career opportunities, identifying career priorities, and helping me to understand what aspects of my career to advance, how to get collaborators for publications, how to advance in terms of academic promotion, and really mentored me as well as a surgeon. He was a orbitocranial surgeon and really helped me in that regard as well. In the center is Lynn Gordon. Lynn Gordon happens to be probably one of the most resilient and compassionate people I know. Lynn is also retired. Maybe that's a theme that I'm moving up there in the years. But Lynn was the Senior Associate Dean for Diversity at UCLA, and she's also an MD PhD. She had an active immunology research lab and was one of the first women to be an ophthalmology resident rising to prominence, and helped me to understand better how to mentor others earlier in their career, in addition to providing me guidance on my own leadership pathway. She was chair of the AAO Council years ago. She's been involved in senior leadership in the California Academy of Eye Physicians and Surgeons. So again, just someone who has, even though she is also a physician scientist, provided more mentorship for me in that aspect of my career. And Larry Froman on the right there is a neuro-ophthalmologist on the faculty at Rutgers in Newark, New Jersey. And Larry is just a consummate example of dedication to professional service. Larry is the executive vice president of the North American Neuro-Ophthalmology Society and has mentored me again in society leadership, in learning how to cross uh, lines between different societies, how to broker agreements between different groups, and really also how to advocate better for our patients. So again, my own mentors continue to work with me even as I get along in years, and continue to provide guidance to me and help me to ensure that I am achieving the goals that I want and that I am moving along those pathways. And they help me, of course, to be better mentors for my own mentees. Now, I think sometimes we have a distinction between mentorship and coaching that needs to be made. And much of what some of us do is more coaching than mentorship, because in mentorship, a mentee is defining their own goals and ideas, whereas in coaching, someone typically comes to you and says, I want to learn a particular skill. A mentor really works to help support and guide ideas, whereas a coach, again, is more shaping that person to acquire skills or knowledge that the coach has. And so, as I mentioned before, in a mentor-mentee relationship, we really should not be having a goal, if we're the mentor, of having our mentee imitate us or even necessarily incorporate our qualities, but rather to learn from our own experiences, to learn how our experiences as mentors can guide them in the projects they are doing as our mentees, and to ultimately help both of us grow in that process. Again, coming back to the title of this talk, the resilience and compassion that come out of the mentoring really arise from that core strength of both participants growing out of this activity. If we look at the difference between mentorship and sponsorship, I think that's another really important distinction to make. And this is a publication from one of our ENT colleagues here on campus, that mentorship is really a longer term relationship. It consists of regular meetings scheduled over time and mutually acceptable times between the mentor and the mentee, helpful for career development in the longer term. So developing your own depth of your research or your own publication record, your own collaborations with others. It is more effective if the personalities mesh. We'll come to more of this in a second. And it may be more important early in the career, although, as I pointed out to you, I think it remains important throughout our career. Now, sponsorship, episodically, promoting someone. So for example, because I'm very involved in national societies, will name some of my faculty to be participants in national meetings or to be on panels or to be participate in a given activity. That's sponsorship. That's not mentorship. And it's helpful for career advancement. It puts them out there. It's more effective, obviously, if the sponsor is well connected. And it may be more important later in the career because usually you have to have had good mentorship and have some body of work or accomplishment that your sponsor can then bring to someone else's attention and say to them, hey, let's help this person. Let's put this person on the stage so that they can continue to advance their career in that regard. And formal and informal mentorship both can be important. And I think that, again, in terms of coming back to personal growth, both aspects are necessary in order to achieve what we do on a daily basis. So assigned pairings, again, I think that you can have assigned pairings, assigned mentorship relationships, at least at the start. We'll talk about how you exit a bad mentorship relationship, but focused goals, having specific timelines for the meeting, and really having some training ahead of time can be helpful so that both the mentor and the mentee know what to expect out of this. Mentorship will allow and should allow for representation of underrepresented groups, and it's a longer relationship. It takes some time to develop that trust. An informal mentorship relationship, as you might imagine, grows somewhat organically. It may be with peers, it may be with someone who is above or below your own academic rank. There's really no training. It's flexible. You meet for lunch every now and again, or you meet in the first thing in the morning before clinic starts, something like that. And it really relies on established connections and it has trust from the beginning. As I mentioned already, that need for sustained, meaningful mentorship never really ends, and it should continue at the end of training and clinical fellowship and postdocs. One of the things I do, again, as vice chair is when new faculty join this department, they sit down with me and I say to them, what are your goals and who is going to help you get there? And there's, of course, a little more to the process of doing that, but at its base, the idea is that we are going to work together to help to identify mentors for faculty at all stages of their careers in that regard. And of course, there are some mentorship programs that have been developed here on campus that I think have been very effective in that regard. Mentorship programs that have been copied from the University of Michigan. I'm not going to repeat that content today. That's available elsewhere online, and encourage all of you who are interested in mentoring to certainly view those materials, take advantage of those materials because they are very good and have been developed with really expert input over a number of years. But mentorship, certainly at the departmental level, even the school level, helps connect people early in their career with those who are in mid or senior level positions. And really, we want to support career decisions at major touch points. And I think that's a key element of mentorship. When I was getting ready to leave my prior institution and come here, or was considering doing that, I relied heavily on my mentors, in particular Lynn Gordon, to give me advice on why I should do what I thought I should do, why I shouldn't do something else, and to just, again, ensure that I was thinking about things in the correct way and that my goals were going to be furthered by making that change. And so it's important to remember that both participants have obligations, both the mentor and the mentee. The mentee can't just show up and say, okay, I'm here to be mentored, mentor me. Doesn't work. The overall goals need to be identified. And they can be broad or specific, and it certainly is going to determine the choice of mentor. But again, I think it's been demonstrated that unless the mentee has some goals or other plans that they wish to advance over the course of that mentorship relationship, it stagnates because the mentor, again, their role is to advance that mentee's plan. It's not to just sit there and impart wisdom and pontificate. That is a completely different aspect, and that's not really what mentorship is about. There need to be expectations for that relationship in the long term or the short term, and it can be either. And again, going back to the idea of resilience and compassion, if it occurs in the course of the mentoring relationship that the person has accomplished what they want to, maybe even sooner than thought, it's okay to draw that relationship to a close. That is appropriate, that allows for growth for both parties involved. There's an understanding that tasks need to be accomplished. When meetings are going to be held, both need to be prepared. And typically that consists of the mentee providing information in advance to the mentor regarding what is going to be covered at that particular meeting session. If there is not an agenda, unfortunately, it's unlikely that the goals are going to be reached in the time frame allotted. And like in all relationships, there is a need to value, honor, and respect that relationship on both parts, right? The mentor should not cancel at the last minute unless there is a serious emergency that comes up. The mentee also should keep that obligation to show up and to be prepared, in particular, to go over what was discussed at the prior meeting. At the end of the mentorship session, there should be take-home notes. There should be points that come away, whether it is something you write down, whether you make use now of an AI assistant that comes up with action items at the end. There really should be some points moving forward to help that relationship to continue to grow. So are all advisors mentors? And I think it's really important to keep in mind that having a mentor who might be in a supervisory relationship is probably not a great idea, right? Because there really is a big difference between a supervisor and a mentor. A supervisor has a stake in your accomplishments in the sense that they are going to be judged in part by your own accomplishments. Whereas a mentor is guiding you there. If the mentee fails to reach their goals, well, the mentor might feel as though they have failed, but there's no direct consequence for the mentor if the mentee's plan does not work out quite as planned. And again, it's a broader relationship, right? The mentor also is vested in growing that career beyond the confines of what you are in right now. And so, you can see some quotes here from a paper from almost 20 years ago, just really indicating that a good mentor really interacts with people beyond their current situation and keeps in touch, helps them to grow even once the mentoring relationship is ended, whereas with a supervisory relationship, that probably is not going to occur. And so at this point, we're about 20 minutes in. And for those of you who may have seen it, I was asked by Amy Gardner some months back to make a little video on how to engage learners. And one of the things to do is really to put in breaks in talks and to have some degree of discussion. And so what I'd like to do is we're going to be divided up into a couple of breakout rooms. And I'd like to just take about 5 minutes. I put 7 minutes because going in and out of the rooms takes a moment. But let's discuss really ideas that you have around the characteristics of an effective mentor and how mentors really should be developed. So let's take a few minutes and do that, and then we'll hop back into this main session.
All right, you can just click breakout room below and it will put you into a breakout room.
I'll go to room 1 then.
And people are still trickling back in. And then we'll reshare your screen. Perfect. Okay, I think everyone is back. And I think we can go ahead and continue the presentation. I'm not sure if we're unmuted.
Sorry, I don't know why it muted me. Sorry about that.
No worries.
That's bizarre. What I was saying is that uh, it has been suggested that people who come from less represented communities are particularly helped by mentorship in terms of developing resilience and compassion and being or having their value to the profession and their organization reinforced. And so it's been, again, suggested that there's this idea of cross mentorship, crossing lines versus having people paired with a mentor mentee who have more shared sort of features to begin with. And if for the shared features, maybe it's helpful if it's someone who's trying to figure out a better work-life balance or family issues. If their mentor shares those concerns or has dealt with those issues, maybe that person is in a better position to advise them with that. Helping with negotiating skills, on the other hand, it's been suggested that having a mentor who comes from a different background than you may bring some different qualities and may help you to recognize how to negotiate from your own strengths because they're able to see some strengths in you that that are kind of different from their own. But interestingly, there was a paper published, this one in the Annals of Surgery a few years back, where they did a survey of trainees about this idea. So the American College of Surgeons had put this idea in particular of trying to promote women surgeons who have who remain less represented than male surgeons in the professions. And this campaign actually struck an off note with trainees because they felt like it was an artifice. And the idea that, of course, everyone's different. And by definition, when you have a mentor, that mentor has different qualities than you, as well as maybe having some shared features. And so they pushed back a little bit against this idea that we should intentionally try to have mentors and mentees come from different backgrounds and rather just let those things develop in a more organic way. So kind of leave you with that in terms of some of the things that we should think about because really, if you look across the idea of mentoring or inclusive mentoring that was published in this paper, the idea of sharing experiences versus mentoring across differences, I don't think there is a lot of difference there. I think it's just being attentive to the idea that your mentee may not have all the same experiences that you do, that the mentee's experience and goals that they are bringing to that session are intrinsic to them. And that if it is appropriate to try to address things like stereotype, threat, and biases, then absolutely do those things. Be cognizant of them, be cognizant, of course, of our own implicit biases. But I think fundamentally the mentorship relationship should bring these things in, right? Because it's about who the mentee is. It's about what you as the mentor are helping to do to further, again, that person's career. And if there are these issues around bias or that are hindering them, then addressing them in the course of the mentorship relationship is clearly going to be important, and open communication is required to do that. And then ultimately being aware of things like traditional views of success. Is success being defined in a way that's not relevant to the mentee? Are the mentee's goals, again, different from the mentors, but equally valid? Is there a focus on trying to rescue someone from a bad situation? That's not necessarily the most effective thing in a mentorship relationship. You're trying to build that person, work on the positives, and pull them forward. Diminishing value of achievements, again, it can be that you unintentionally label someone as a rising star, but when do they stop rising? When do they become a star? And so it's really important that we keep that in mind, that we put our mentees forward, that we've helped build their careers, but we recognize that we're building them to a point. We're not like, again, they are already accomplished, right? They're coming to you because they have accomplished something already and they want to accomplish more. It's not really about your trying to discriminate, oh, well, this is more worthwhile than what you did before. So being available and committed to that mentorship relationship, actively listening, it was brought up in our breakout session that active listening was critical for helping the mentee feel like the mentor really was engaged. Again, flexibility, creativity, being willing to critique, and helping to grow potential in the mentee. This helps the mentor grow, of course, too. And ultimately, again, the main goal is success of the mentee. Success does not mean a little clone of me comes out at the other end. Success means that the mentee's plan that they came in with actually is executed. And so I'm not going to spend too much time talking about where to find mentors, but in general, in our early career, we tend to look to colleagues. I think it's important to encourage our early career faculty, our fellows, even our residents, to look outside our own specialty. There may be people, again, it's not specialty related in terms of what they want to do. They may have research goals that are outside that are just personal goals that are better met by people from other departments. And a mentor does not have to be a doctor or a PhD scientist. I have formed mentorship relationships with people I graduated from college with who are clearly in different professions, but have helped me to accomplish goals that maybe were not quite as aligned with medicine, but were important to my own career, such as, again, leadership and advocacy. And then later on, of course, we tend to concentrate more on our interests with leadership development programs out of specialty and subspecialty societies, regional, national scientific societies, academic leadership, clinical trials, and things like this. And again, does not have to be a doctor or a PhD scientist. And so I think that at the first meeting, again, in terms of helping that mentee to accomplish their goals, to be resilient, to have compassion for their patients and for others, it's important that the mentee feel that they are supported, and that support comes from defining what the goal of the relationship is and reviewing what specific qualities actually that the mentee is looking for in the mentor. They may say, hey, you started your own lab and got an R01 at a couple of years before you were promoted to associate professor. I want to be in that position. How can you help me develop my research plans? It can be as specific as that. And then the mentee really should have a sense of how to accept that advice, that guidance, that direction from the mentor in order for it to be successful. And so mentors need clear expectations of their roles, need to know to listen, have feedback skills, to be aware of culture and gender issues, and to support and challenge mentees, right? We talked about this briefly in the breakout session. Mentors shouldn't just validate everything the mentee is saying. If you don't challenge their ideas, they're not going to grow. And it's a forum for the mentee to express themselves. And the mentor needs to be aware of professional boundaries. This is a professional relationship. I mean, yes, you might like the person you're mentoring, and the mentee may like you too, but really it's different than friendship. And there should be some recognition for mentors. I think this institution has some mechanisms in place to do that, and I encourage all of us to continue to do that, to recognize mentorship, because mentorship is hard. Mentorship takes time, and there should be a reward for it. There should be protected time. We should encourage people to do peer mentoring and then constantly evaluate the effectiveness of it. I encourage my faculty to have multiple mentors because there's no one mentor who helps with everything. And it may be multiple mentors sequentially, it may be multiple mentors simultaneously, or both. And a great mentor-mentee relationship, again, starts with mutual respect and trust and works well for both, but it absolutely deserves reassessment over time and evolves to fit different needs. Not perfect, not predictable, and it may or may not be time limited. I personally think that most mentorship relationships should start at least on a time limited basis. There should be a defined period, 1 year, 2 years, 6 months, whatever. And in that context, then it can be extended, but it also gives an exit if it is not working out the way either party or both parties want together. And it's an exit without consequences, an exit without repercussions for anyone. And I think that's really important because I pulled these cartoons off the web in terms of styles. And, obviously it's a bit of a joke here in terms of, and this is somewhat research lab specific as a PhD. I like these sorts of things. But there are various styles that people bring to their mentorship and sometimes the supervisory relationships. And some of these are demonstrated here, right? Big talkers, slave drivers, etc. My own PhD mentor was kind of the small town grocer. He left me alone. He liked his little niche. He didn't want to hear about negative results. And, I think that I went 1 year without seeing him. And so that was not a great mentorship relationship. And that really helped me to recognize that sure, some people might feel like that's mentorship and that's guidance, but I think most of us would not. And so we'll take a moment again for discussion here before we finish up. And I really want to let people talk about some mentorship traits or qualities, maybe a little bit different than what we talked about before. In specifically, what things have you found to be most effective and which ones are least useful? Which ones do you think that are exhibited by mentors sometimes and which ones should we abandon? So let's take a few minutes to talk about that.
We have 16 people back in the main room. Let people have a couple more minutes. There we go. Great. I think we can go ahead and get started again.
Yeah, it muted me again. Crazy Zoom. Okay. Well, anyway, all right. We'll round this out here. And really what I want to do is finish out by really talking about making the most of your mentorship and then ultimately how you exit from a mentoring relationship if it's not going right. So really this corporate concept of managing up, which really helps to promote both the mentor and the mentee and make the mentor's job easier. So it requires the mentee, right, taking responsibility for their part and being a leader really in the relationship. You're the mentor, but your mentee kind of is the leader. They're directing what happens. So the mentee takes ownership, directs the relationship, and lets the mentor know what they need and communicates in a way that the mentor prefers. And the mentee sets the plan, sets the meeting agenda. And in the breakout session, it was just mentioned that the agenda at one time may be, let's talk about the big picture, my career 5 years from now. And then another time may be, well, I have this specific problem that I'm working on. Let's talk about solving it and how I should be moving forward with it. And they have to complete assignments and they should request feedback. That should be part of the relationship as it originally develops. Clarifying values, identifying a work style and habit. I think if the mentor and mentee at least don't recognize that maybe they have different styles or same styles, that can be a barrier to making sure that goals are actually met. Identifying gaps in skills, identifying where guidance is needed and writing down goals. I make my faculty write down 1, 2, and 5 year goals. And it is, I think, essential to setting up that mentoring relationship and being able to identify the things to work on. And so things to look for in a mentor really is you want them accessible and available. That's again coming back to the idea of resilience and compassion. If your mentor is not available, how are you going to feel good about yourself? How are you going to feel like you can reach out to others? It just doesn't happen. You have to provide opportunities, encourage the mentee to take risks, and help the mentee develop their own agenda. I said the mentee is responsible for the agenda, but if they throw their hands up in the air and say, can you help me get started? Absolutely, that's your role. And prior mentoring experience certainly helps. We all have informal mentoring experience, even if not formal. And so none of us go into this totally unprepared. Going in with a plan, really the mentee markets themselves to you. It's a little bit of a self-promotion that first time, but it has to be, right? This is what I want to do. This is what's going to make me get to the next step. Here's how I'd like to work with you to get that done. And then we mentioned in the breakout session about having permission to ask for future interactions. That has to be intrinsic to the relationship. And following up with a summary email, a text, whatever means of communication that the mentor and the mentee feel is going to be most effective. And so once you have that action plan in place, it's important to be realistic, to rank important topics, and to figure out as a mentee if you need additional mentors, right? You may go into a mentoring relationship thinking that this one mentor is able to solve problems for you or help you to solve problems, right? The mentor is not the problem solver. The mentor gives you tools or helps you to recognize tools, to find ways to accomplish the goals. And really proceeding, sticking to the path, having the plan, but not being afraid to modify the plan along the ways. I think that's a critical element of what the mentor does. If it looks like progress is not being made along the plan as originally laid out, the mentor can and should challenge that appropriately with appropriate questions, with appropriate redirection. And again, you're not going to end up with a resilient mentee if they are banging their head against a wall. They are going to feel unfulfilled. They are not going to be able to move on to the next thing and to continue to advance their career. And then my second to last slide here is what you should do if the relationship isn't working, right? That's not just personal relationships that go bad, professional relationships can sour too. And so you can just take a moment to look at this slide. I'll touch on some key points. Number one, open communication, right? If you haven't had open communication to begin with, well, that may have led you to where you are, where this is not working. And if you have had communication, the problem is in the process of being resolved, you may need to get other people involved to help you to maintain that mentorship relationship if if path forward is not being found or if the problem is not being resolved. And ultimately, I think this is where having a bit of a mentorship structure within a department is helpful to our younger mentees, because they may feel like they're failing if the mentorship relationship is not working out, where in fact it may not be their doing, and they simply need a different mentor. They need a different relationship. They need someone who is going to be able to help them in a different way. And we need to create a system ahead of time that allows for a graceful exit. We don't want to form, we don't want hard feelings from a mentee mentorship relationship that does not work out. I think it's very important, maybe even at the beginning of that mentor mentee relationship, to recognize and have an understanding that there may be times where this relationship needs to be ended. And so I'll just finish by saying, again, a life is not important, except in the impact it has on other lives, has been said by Jackie Robinson. And I think that that really speaks to the goal of mentorship. And so my takeaway points are that resilience and compassion arise from key things that we do in our mentorship relationships. We give our mentees the ability to grow. We help them to have personal security. We help them to have internal strength so that they can be compassionate and so that they can bounce back from setbacks. These things grow with mentorship, and a good mentor furthers the mentee's goals, resulting in personal growth for both parties, and sets the stage for the mentee to grow into a mentorship role. And so with the remaining few minutes, happy to take any questions. Thank you.
Thank you so much for this presentation. I took notes along the way. One question I have for you is, we are in short supply of senior faculty within the OBGYN department. What are your thoughts about mentor programs where you have like one senior faculty assigned to, 3 to 4 junior faculty, just to kind of help create a pairing, but also help establish mentors because we're in short supply?
No, I think that can be effective if there, again, as long as there's a definition around it about what the purpose of it is, then that can work. And I think it can be effective if, as you said, you don't have enough senior faculty to go around and there are specific issues that have been identified by the junior faculty that they want addressed. So I think there's not a problem with doing that. It can even be done in a group setting if that is something everyone agrees to.
Thank you. Any other questions? If you don't feel comfortable speaking up, you can always put your question in the chat, and then happy to share that with the group. It was just such a good topic. No one has anything else to add to it. You covered it all. Well, we have maybe one more minute. If anyone has anything to share, great. Otherwise, thank you so much for your time, your insight, and we really do appreciate, a lot of this guidance, because there's definitely a need for mentorship and also how to be a great mentee.
All right. Thank you all. Thanks for coming. Bye-bye.